My name is Judy Ashley, and I am your host for this program about a unique group in our area that is making an immediate, direct, and positive impact in our community. The name of the group is 100 Women Who Care, Franklin County, and we are one of more than 400 chapters around the world, and the first chapter in Vermont. Our mission is to provide financial assistance to nonprofit organizations that have a strong presence in and serve residents of our county. Our chapter meets for 1 hour, 4 times a year, and any member in good standing can nominate a local charity in advance of the meeting. At the meeting, 3 charities are randomly selected, and members vote by anonymous ballot on which cause to support. Each member writes a check for $50, and the collective donation is presented to the director of the organization. Today, we will meet a local nonprofit that was awarded funds through 100 Women Who Care, Franklin County, to learn more about them and how they use these funds. So today I'd like to welcome Jana McCarthy, who is the Executive Director of Franklin County Home Health.
Thank you, Judy.
Yeah, thank you for being here. And Ella Dupont, who is Director of Clinical Services for Franklin County Home Health.
Thank you, Judy.
Thanks for being here, both of you.
Thank you.
So first, just to start, tell us a little bit about Franklin County Home Health. What do you do? Who do you serve? Just so our listeners can know a little bit more about your organization.
Well, Franklin County Home Health Agency has been providing services to the Franklin County community since 1969. We're sometimes known as a home health agency, sometimes known as your local visiting nurse association. Mm-hmm. So we take care of patients after they've been discharged from the hospital, perhaps they've been discharged from a nursing home, and we care for people in their home to meet their healthcare needs. We have a staff of 170 people composed of nurses, nursing assistants, occupational therapists, physical therapists, speech therapists, social workers, home health aides, personal care attendants, and of course our billing and administrative staff. And we serve all of Franklin County. We have 2 offices. We started with a very small home care program, and we've grown. We now are a Medicare certified hospice program. We have a very extensive long-term care program. So we're there to take care of people when they need health care at home.
And you've been there for a while.
I have. I'm actually celebrating my 29th anniversary in a couple weeks. So
really?
It's hard to believe it.
Congratulations.
Thank you very much.
Congratulations.
Yeah. I came for 5 and I stayed a little bit longer.
You came for 5?
I came for 5.
Stayed longer? Yeah.
Yeah. It's been a wonderful organization to work for. You know, my family members have been served. I'm very proud of that. I'm very proud of the work that we do, and it's always changing. You know, healthcare is changing a lot, and home care has changed right along with it.
Yeah, I was going to say, and in that time you've probably seen a lot of changes.
Oh, incredible. My job today is very different than 29 years ago, that's for sure.
Yeah. So tell us a little bit about how you've been involved with home health and what you do.
Well, as the Director of Clinical Services, I like to think I'm the chief problem solver.
Chief problem solver?
Yes.
Can I hire you?
Well, for the right price, maybe.
No.
So right now I oversee home care and hospice, and I help figure out solutions to the problems that arise daily. I also oversee the rehab department and the social work department directly. And I just do what I think needs doing to help us provide good clinical care to everybody.
That's great. Well, thank you. And how long have you been with Home Health?
Just over 5 years.
Fabulous.
And I'm staying. I'm not doing 5 years and done. So.
All right. That's awesome.
I can shoot for 29 like Janet.
Yeah, there you go. Longevity, right? Keep it going. So how did you get involved? You're both involved with 100 Women Who Care. Can you tell us a little bit about how you got involved and what you like about it? And
Well, yours truly is the reason I got involved. You know, when Judy Ashley calls, it's hard to say no to Judy.
Oh, dear.
Which is why we're sitting here.
But I was also very intrigued with the concept. I like the idea of being able to support important organizations in our community that particularly might not have the resources to do formal fundraising and fund development. I really like the idea of my vote makes a difference. You know, I get an opportunity to choose from 3, and I feel like I'm empowered to do that. And we're the 3rd organization to receive funds, so I feel gratified to be able to see how those funds have been used by those prior organizations and feel like my $50 made a difference. And I know Ella's really excited to tell you a little bit about how we used the
Right.
money.
Tell me first how you got involved with 100 Women.
Well, Janet invited
There you
me
go.
to join, so it really is kind of a network of, I think, people bringing people in to say this is a really cool thing that people in Franklin County are doing. So I read a little bit about it because I don't just jump into things. I'm a bit of a planner, and it just seemed like something I wanted to be involved in. I like the idea of a bunch of people getting together and pooling their resources to make a really big difference for one organization, because it's easy to write checks for $20 here and $50 there, but it's something about everyone getting together and giving a lot of money so you can do some really good things with a pool of resources really appeals to me.
Great.
So.
Thanks. Yeah, I love it too. So, as you mentioned, you were selected to receive funds.
We were.
So, part of this is just finding out what did you do with the money that you got?
We put it to good use.
I think
I know
so.
you did. I've already heard, but we want our listeners to hear.
Yes.
So,
So we did use a lot of the resources for professional development for our staff. The goal is to really develop our staff and help them get better at the work that they do so they can provide good care to the people of Franklin County, but also with the thought that developing people in Franklin County makes them want to stay here and live here and work here and not look for opportunities elsewhere. So we put a lot of those resources to the professional development. So some of the things that we did, we used the money to pay for hospice certification for 4 of our licensed nursing assistants. And they're in the process of getting ready to take the test to become certified in provision of hospice care. So I think that's really exciting because I feel like that particular segment doesn't always get a lot of opportunities for continued professional development. So we're able to give some money to these ladies that are going to develop their skill set and have something that they can say that they did and they accomplished and they now have this certification.
and that's different from being a hospice volunteer, right?
It is, yes.
Okay, so much more training.
Yes, there's a lot of training, and what it does is it gives them kind of a specialty in really understanding what it is to give really good hospice care to people and really focus on those things that make kind of the end-of-life experience meaningful and provides good quality of life during the whole process.
So I don't want to put you on the spot. I know there's other things that you use the money for, but a lot of people don't even know what hospice is. Do you want to just talk a minute or so about what is hospice?
So hospice is really a way of caring for people, focusing on those symptoms and trying to improve the quality of life for people who are facing the end of life. And there's all kinds of rules and regulations, but we, really like to develop a relationship early with our patients who are eligible for hospice services. We provide volunteer services, chaplain services, really focusing on symptom management. And support for families, not only during the last days process, but also up to sometimes a year, sometimes more than a year after a person has died, so that they receive the support and bereavement services that
This would be
are
like bereavement
beneficial.
counseling.
Be bereavement counseling,
Right,
and just sometimes a phone call to say, I know this was your loved one's birthday, and I'm thinking of you today, and I wanted you to know that. Sometimes brings great comfort. So hospice it's a formal program, but I like to think about it more as a way of providing care to people who are facing the end of life.
And that care can be provided anywhere, right?
Yes, we provide it in the home, we provide it in nursing homes, we've even been able to provide it in the hospital in certain situations. So wherever a person is in Franklin County, we're there.
That's great. Thanks. So going back to the funding, it was great. We got some folks who are more trained in hospice care and
Absolutely, and
all
the
that.
philosophy.
And I know you did some other stuff.
We did
as
do
well.
some other things.
Yeah.
We actually invested some of that money to get some people sent to an Oasis training class. Oasis is a required assessment that we have to do for people we admit to the agency. It's a little hard to understand. You need training to understand it, to do it well, and we were able to send 2 people to training with some of the funds. And I myself was certified as an Oasis clinical specialist. So we were able to use our funds to do that. So personally, I'm very grateful because it really helps me explain to everyone else what some of the questions mean. I just have a better understanding in helping people complete things accurately,
Right.
which is always a good thing. And we used some of the funds to buy some educational information. We developed further our leadership lending library, which is a book of leadership resources that we use in conjunction with our leadership development program to help people develop their skills to become leaders in our agency and in other ways as well. So we used some money to buy some resources there, and also some DVDs on wound care, which I'm particularly excited about, which I'm sure sounds crazy if you don't know me, but it's something that I think will really benefit some of the newer staff in learning how to provide really good care. And I'm pretty sure that was everything that we used the funds for. I was like, oh my gosh,
I was
the
going to
biggest
say, I remember
thing.
you bringing an arm to the
I
meeting.
did bring an arm to the meeting,
and everyone bringing the arm today.
everyone thought I was crazy. That is kind of, the cherry on the top was the ability to buy this simulated arm that lets our nurses practice venipuncture.
Yeah.
So we brought it to a few meetings, and the nurses were all able to really practice on this arm and really draw fake blood and see what it's like to do different types of sticks and how to
Start an IV.
Oh yeah, it's just a really, really cool tool, and it's so lifelike that it's a little bit creepy, but very, very useful for the nurse training, especially for our newer nurses that we have. So
As someone who doesn't like to get their blood drawn, I appreciate the fact that you have a fake arm to do
practice.
it on and not my arm.
yes, exactly. We definitely want to send people out who've had some practice before they start sticking people, and I was not ready to volunteer my arm.
Yeah.
So
how
yeah.
have staff reacted to these new resources and opportunities that you have?
I think
what kind
they've
of
been-
feedback you getting?
I think they've been very, very grateful for the opportunities. I know that the LNAs are very, very excited to have the opportunity to get this certification kind of under their belt. The arm was such a big hit that I've had to pull it out on more than one occasion just to let people practice. Both offices are requesting, I think I'm going to need a sign-out sheet for the arm. So that's been really great. And the resources themselves have been lent out a few times already where people have borrowed them. So
So we're getting down on time, I was just told. So tell me a little bit more about how people can continue to support your agency, either through donations or volunteering. Can you just tell us a little bit?
I'd just like to say we'd like to be considered as the first choice for referrals, our referral sources. We'd like to be the first choice if you or a loved one needs home care. Think
So
about
anybody
us.
can call you and make a referral?
Yes,
I could call and...
absolutely, and
Okay.
we'll take it from there. We'd love to be the first choice for employment, so if we have any healthcare providers out there that are looking for a job, we're the place to call. We have volunteer opportunities. We've got all kinds of things that are going on all the time, and of course we truly appreciate the community support that we receive from our generous donors. So call us at 527-7531 or send us an email. Check our website out, and we truly appreciate the community. It's just it's a great community to work in, great community to live in, and we really, really appreciate the 100 women who care.
so much. Yeah.
That's great.
Yeah,
That's
so-
great. I think you have your 10th anniversary, 10th annual
Blue Jean Ball.
Blue Jean
gosh,
Ball.
it's coming
I
up.
can't believe
Forget
you didn't
that.
mention that.
Well,
It's coming up.
I wasn't sure when the show was going to tape.
I know. I've
yes,
been bad about that.
It's
but
coming. It's coming right up.
Taping this in October, so if you're watching it after October 20th, the Blue Jean Ball will be over.
Yes, but we'll have another one next year. And,
Yes,
and
you
folks
will,
can
so
come.
look for it.
So just a tremendous, fun time. Where people wear their denim, and this year's theme is diamonds. So we're expecting to see lots of bling.
And
on
you
Saturday.
have a DJ, and you have food.
Yes, live
and-
auction, silent auction. But
Silent
it's really
auction.
more about coming together and having fun.
Yeah.
And that definitely happens.
Great. Well, thank you both. 100 Women Who Care Franklin County is perfect for you if you are committed to helping others in our community, but stretch for time. You want 100% of your donations to go directly to a charitable organization in Franklin County. And you want to be part of a caring and amazing group of women that are making an immediate and positive impact in our community. We invite you to join us in supporting the amazing work being done by local nonprofits in our area. Please check our website for the next meeting date and a quick membership form. Thank you for your time, and I hope to see you soon.